Hello there.
Hi, everyone. Hi, good afternoon. My name is Emily Haynes, and I'm the Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you so much for joining us today for the Essex Metro Immunization Coalition meeting. And I'm going to turn it over to the chair of our coalition, Dr. Joe Schwab.
Okay, thank you, Emily, and welcome everybody to the meeting for our the first meeting of 2023. We're happy to have you all here. We have a very interesting meeting scheduled today with some very good speakers, so we'll be looking forward to that, as well as some updates regarding the coalition's activities. I'd like to first invite anyone who'd like to introduce themselves, especially any new members we might have on the call. As we wait for a few more people to join, and welcome to each of you. So if anyone would like to introduce yourselves, who you are and where you're from, please feel free to unmute and do that now.
Hi, everybody. My name is I guess I'll start. My name is Teresa Rowe. I am an NJIS trainer with the Partnership for Maternal and Child Health of Northern New Jersey.
Teresa.
Hello, my name is Misan Oroye Lane. I am a health coordinator for the Head Start program at Newark Board of Education.
For joining us.
Hi, guys.
Go ahead. Hi, my name is AC Green. I'm a pediatric vaccinator and educator with Southern Jersey Family Medicine.
Welcome.
Hi. I'm Maria Shanklapuri. I am the new director for Engine with NJAP, and I look forward to working with all of you. I thank Emily for inviting me to be part of this coalition.
Thank you for joining us.
Hi, this is Leanne Lowenthal. I am an NJIS trainer and recruiter with the Partnership for Maternal and Child Health.
Thanks for joining. I have a few people introduce themselves in the chat. Katie Stewart from Morris Somerset Regional Chronic Disease Coalition in Somerset County Department of Health. Zachary Ehrlich, Adolescent and Adult Immunization Coordinator at the New Jersey Department of Health. And Lori Herrick, Regional Chronic Disease Coordinator for Middlesex County. Joanne from Securus is here for flu vaccine. Jessica Mindo from Union County Office of Health Management. Welcome to everybody. Milka Rodriguez, Moderna. I'd also like to remind you, everyone should have received the minutes from our December meeting. So if you've had a chance to review those, if anyone does have any corrections or additions to the minutes, I think the best thing is maybe to put that into the chat or send them to Emily. And if not, and anyone would like to get those minutes into the record, just type your yes or no into the chat and we'll count that up by the end of the meeting.
Hi, I'm Colette Oliveira, and I am with Pfizer Vaccines. I'm the new COVID-19 vaccine navigator.
Welcome. Great. Public Health Nurse Supervisor with the Randolph Health Department. Thank you for joining us.
Dr. Schwab, it looks like Iris made a motion to approve the December minutes as well in the chat.
Very well. up to 30 participants. I think we expected a little over 40. So as we go through, if you'd like, you can approve the minutes in the chat, as I said, and I think we can move on to our speakers then, since we have a pretty packed agenda. So I'm really happy to welcome two members from Horizon Blue Cross Blue Shield of New Jersey to speak to us this morning about improving vaccination rates in the time of COVID-19. Our two speakers are Khadijah Anderson, who is an LPN and has a Master's of Public Health and is the Outreach and Interventions Manager within the Quality Improvement and Management Department for Horizon Blue Cross Blue Shield of New Jersey. Khadijah has over 10 years of experience in quality management, performance improvement, and she's a licensed practical nurse with 21 years of experience and also has a Master's in Public Health. In her current role, she manages the Horizon Healthy Journey team, which conducts member engagement initiatives and interventions for several lines of business in efforts to engage and educate members on the importance of preventive screenings, chronic condition management, medication adherence, and timeliness of visits. And joining her is Iris Novas Cooney, who initiated her clinical career in healthcare as a registered dental hygienist in 1998. And her experience with patient care, fueled by her passion for global public health, specifically in community health science, brings her to us. She completed her master's in healthcare administration and community health science in 2011, and she continued health services as a clinician and pursued expanding her experience in public health research at NYU School of Medicine in the Department of Population Health. In 2015, Iris joined Horizon Blue Cross Blue Shield in the Department of Member Advocacy and Community Outreach Transformation. And in her current role as manager of the Community Health Education team, Iris's focus has been on health education development and health promotion initiatives, with an overarching objective of establishing and sustaining member and community partner relations and expanding Horizon Blue Cross Blue Shield's reach and influence on the health and wellness of New Jersey residents. And so welcome to both of you. We're looking forward to your presentation to us on improving vaccination rates in the time of COVID-19. Thanks.
Thank you so much for the invitation. Longtime member of EMIC. I think this is my first presentation for the EMIC group, right? So I'm happy to be with you and an honor to have this co-presentation opportunity with my colleague Khadijah. I'm just going to share my screen very quickly. Give me just one quick second. Let's see. Let me know when you see my screen so that I can present. Awesome. Thank you, Emily. So thank you again for that lovely introduction. And it is an honor to present to all of you this important discussion and the ongoing work to improve vaccination rate compliance. So at Horizon, our division leads in the Medicaid space under NJ Family Care, servicing all 21 counties. Horizon NJ Health is the largest community health plan, and we are dedicated to keeping the people of our state healthy and well. Horizon NJ Health believes that families deserve affordable, quality health care, and NJ Family Program allows eligible children, single adults, families to become members of Horizon NJ Health for low cost or in some cases, no cost at all. As of February, we have slightly over 1.2 million members that we serve. And as part of the advocacy and outreach team, we aim to reach our Horizon members, but we also provide our outreach educational services to all New Jersey residents, whether they are our members or not. As part of our outreach efforts, we do offer different plans. So there's the Medicaid plans, and then there's other sub-plans within the Medicaid space. There's the combination of Medicare, Medicaid, which is widely known as DSNP or dual eligible. And then there's the Managed Long-Term Services and Support, or MLTSS, which is another program subset within the Medicaid space. So the Department of Member Advocacy and Outreach consists of two main subdivisions. There's the Community Health Team and the Health Education Team. Now, our community health representatives are NJ Family Care subject matter experts. They help explain NJ Family Care benefits, eligibility, and supportive services. They assist with enrolling individuals to Medicaid and identify Horizon members and connect them to Horizon Medicaid support programs internally, like case management or the renewal assistance, which we'll talk a little bit more extensively towards the end of today's discussion. Member services, and then other related social determinants of health, like food security or food access, housing assistance, transportation, etc. There are other individuals within our community health team that focus on events coordination, sponsorship, strategic outreach analysis of where we should be focusing our outreach efforts across the entire state. The health education team is the team that I'm privileged to oversee, and we are differently disciplined population health professionals specialized in community health education. We develop evidence-based health education presentations, initiatives, and programs through both a public health and social determinants lens, specifically for populations within government programs, line of business. So all of our presentations that we develop are for everyone, but we develop them to reach and connect vulnerable population subset, right? So those populations that tend to have a lower literacy rate and even lower health literacy rate, the most vulnerable within our population, we create and develop decision aids or health education presentations and content in order to, one, increase their health literacy, two, promote prevention services, and three, teach the advocacy portion for themselves. So not only like what those coverage under Medicaid are, but how you use them. Included in these outreach efforts are a community health nurse, which provides free preventative screenings, either blood pressure, cholesterol, A1C, glucose, BMI, amongst the health screenings that are offered. During the pandemic, obviously they were halted, but now we have re-engaged that component of our outreach efforts to be included as well. So I'm sure that you've seen our mobile unit, you know, the blue wrapped van, and this is a really great like a great tool that we use, because when folks see it, one, they know that they can get health related information or Medicaid related information, but also they can use us as a local social resource hub where they can get additional referral services or assistance for at a local level, right? So if they need information on a local FQHC, or if they need information on housing assistance, et cetera, they can go to the van and ask for assistance, and they'll be more than happy to help them and connect them to different services. So as part of the outreach and advocacy team work, we are really focused on, you know, health literacy, as I mentioned earlier, and helping informed decision making, right? Understanding the NJ Family Care benefits and supportive programs, but also like learning how to navigate the healthcare system. It is very murky, it is very confusing, right? And we want to ensure that they have the proper tools and the knowledge to pose those related questions to their healthcare team, right? Not just the doctor, but the nurse, the front desk person, the secretary that's greeting them, anyone within their healthcare team, the social worker, that they can pose these questions confidently and leverage this team in order to help improve, maintain and improve their health. The aim is to decrease emergency room utilization, increase preventative health services, including vaccination compliance, and improving the overall health outcomes of our members and the larger New Jersey community. And now to discuss pandemic-related immunization rates and Horizon vaccination compliance intervention programs, I will turn it over to my colleague, Quality Outreach Interventions Manager, Khadijah Anderson. Khadijah?
Yes, good afternoon, everyone. I would like to thank you all, Emily and Dr. Schwab, for inviting me. Iris, thank you as well. So as mentioned before in my introduction, I am a colleague of Iris Cooney. My name is Khadijah Anderson, and I've been working with Horizon since 2020, actually, in the midst of the pandemic. So some of the information that I'm going to give you today is just to give you some context on the role that my team and quality management plays in, really the role that quality management plays in all MCOs, managed care organizations, and then I'll explain, I'll delve a little bit more into my particular team and the effects of the pandemic and, you know, the effects that the pandemic has had on childhood immunization rates. So in general, for quality management and performance improvement, a lot of this information you may already know, but I just want to give you some context around it. So in healthcare, quality management refers to administration of systems design, policies, processes that minimize, if not eliminate, any kind of harm. And we also want to make sure that we're optimizing patient care and outcomes. And I'll put this in layman terms in a second. So then we have quality management has several roles and responsibilities such as accreditation, regulatory oversight, and HEDIS performance improvement for managed care organizations. And many may already be aware of HEDIS, but what HEDIS is really an acronym. And the acronym is basically Healthcare Effectiveness Data Information Set, and HEDIS is widely used throughout all managed care organizations, and it's actually maintained by the NCQA, National Committee of Quality Assurance. So essentially what HEDIS is a measure set. I like to think of it as like a report card that all managed care organizations, we produce a HEDIS project every year. And what HEDIS is basically a retrospective look on certain levels and certain measures. The measure, HEDIS is composed of easily over 90 measures. And what the measures are, the aim of the measures are to make sure that our providers are providing our members with appropriate care. And all of these measures are developed with clinical guidelines, right? So the clinical guidelines that's currently in place and approved by the medical committee is what we use. We use those measures or we use those to create measures to make sure that members are getting appropriate care. And then once we use those measures, the managed care organizations, then NCQA looks at us and say, okay, well, you have a group, a set of members, right? So let's say in our case, we have 1 million plus Medicaid members, right? So you have a set of your members. Okay, so how do we know that you guys are providing appropriate care? And we work with, my team works with the member engagement portion, right? That involves educating the members, preventative screenings and so forth. And then we also have an additional team that works with providers to make sure the providers providing the appropriate care and documenting this appropriately so we can now report that information to NCQA. Next slide, Iris, please. All right, so we have a few domains within HEDIS, and there's 6 different domains: effectiveness of care, access and availability of care, experience of care, utilization and risk adjustment utilization, health plan descriptive, and measures reported using electronic clinical data systems. Measures reported using electronic clinical data systems is basically admin data. So we use claims to see what's going on, because every time you go to a doctor, as you guys may already know, the doctors submit a claim, and that's how they retrieve their payments. They submit their claims to the health insurance of that member, and then they receive their payments, right? So for the purpose of this conversation, I'm going to focus in on some of the measures for effectiveness of care, right? And effectiveness of care, basically, those are the preventative measures. That also includes the childhood immunization measures that we're going to focus in on more so. So for the purpose of this conversation, I wanted to focus more so on the childhood or the pediatric measures for Medicaid, because I was told that we were focusing on childhood immunizations and how COVID affected the various measures. So in general, I would like to mention, I didn't put our rates here only because this is proprietary information, so I didn't want to put our rates here. But in general, I can say with conversations with the state that COVID has had a significant impact on our immunizations among our childhood or our pediatric measures, I would say, across all managed care organizations. This is a topic that we are actually working together collaboratively throughout the state to try to make some improvements. There's a lot of reasons for that. A lot of the reasons we have actually surveyed. We surveyed some of our members, or the parents of our members, I should say. We surveyed the guardians of our members, and we also had a survey among managed care organizations. And a lot of this information that was shared was basically, it was due to one, everybody know that the kids were, due to the mandate, many kids stayed home for, I want to say maybe a year and a half or close to 2 years. So a lot of parents naturally, parents were, concerned with the task at hand, right? Making sure their kids were learning, assisting their kids with learning. Not only that, keeping them healthy and keeping them safe. In a lot of cases, a lot of the kids did not get to go out as often as they should. And unfortunately, it also impacted just a lot of parents education-wise. Sometimes they felt as though, okay, well, my kid is at home. A lot of us are, a lot of the parents are vaccinated. So they just felt as though, since my kid is staying home, can we skip out on some of the immunizations? In addition to that, we also had the providers who, the providers were challenged with staffing. That was a big proponent of this staffing. And not only that, but because of the staffing, a lot of the doctors, when they did start to reopen, they had to limit the hours because of staffing issues. So with that being said, all of those things that I mentioned, all of those reasons played a big part. Nonetheless, I know all of us are happy that, we're back, to our normal lives at this point. We still need to be safe, but we're back to our normal lives, and kids are back in school. So now as an MCO, we were faced with, okay, how do we get our members back to where they need to be? How do we get our kids back immunized to the level of where they need to be? And a lot of the interventions we put in place, a lot of these interventions that I'm about to discuss, a lot of them we had already in place prior to COVID pandemic. But there's additionals that we also put in place with just having members catch up and educating parents about the importance of having, the kids catch up for immunizations, right? So I also placed in here in the slides the different types of interventions we currently have in place and how we're preparing ourselves and educating our members to, to have their kids go back out to their doctor's office and really emphasize the importance, because I know that, a lot of the kids, they lacked their immunizations, but we're trying to really encourage the parents on it's okay that they lacked, because everybody know about COVID, but the most important part is let's get the kids back up to date to where they need to be, because there's a purpose for vaccinations, as we already know, right? We want to keep the kids healthy. All right, so some of the measures, it was a little long-winded, sorry, but some of these, the measures I have listed here that were impacted. In general, I also listed here that a lot of our vaccinations were impacted, or our rates were impacted about 5 to 8%. We saw a 5 to 8% on various measures. We saw a decrease within 2021. The reason we saw one in 2021 is because, as I mentioned, HEDIS, when we look at retrospective, right? So currently we're in HEDIS project right now for 2022, right? So we always look backwards. So we saw our rates really decline in 2021 because we were looking at 2022. And then we saw some of that carry over into 2021 as well. So some of the measures we have listed here is childhood immunization. We call it CIS, which is Combo 10. And Combo 10 essentially is it's a list of all of our vaccinations that we have that our children are supposed to have by the age of 2, right? There's a whole list. We have the Tdap, the Hep B's, the polio, flu. It's a variety of them that they're supposed to have by the age of 2. So that is our Combo 10. And then we're also going to talk about our well child visits. The well child visits that kids should be having in the first 30 months of life. We have the childhood adolescent well child visits, immunization for adolescents between the age of 12 and 13, and then we have our lead screening childhood. Lead screening in children, right? That they're supposed to have a lead screening by the age of 2 for HEDIS purposes at least. Okay, so next slide, please, Iris, thank you. Okay, so these are I just wanted to go over some of the interventions that we have in place now and how we're educating our parents. So as I mentioned before, I have a team of seven employees that we are, as a team, we're responsible to educate our members on the importance of preventative screenings. One of our lines of business is Medicaid. So all of the information I have here is going to be pertaining to Medicaid pediatrics. Okay, so we have our happy birthday cards, which I'm going to show you in a few slides to come. We also have our 0 to 15 month wellness and immunization mailers, preventative care letters, our HPV flyer insert, and our lead screening in children letter, and falling behind postcards. Falling behind postcards is very important as it pertains to the topic we're talking on, having the members catch up. And then the immunization IVR campaign. So I will go through them singly. Next slide, please, Iris. Okay, so here are a few examples. So we have our happy birthday cards. Our happy birthday cards basically serve the purpose of, one, we want to actually wish our kids, their happy first birthdays. So this birthday is actually submitted or mailed, I should say, mailed to the parents of the kids that are about to turn 1 year old, right? So we typically send it out like a month ahead, and we also use this opportunity to educate our parents about why it's important for the kids to go in, and we remind them of what the kids need. So the kids need to go in for their well child checkup. They need to go in for their shots. They need to have their first lead screening if they have not had one already. And then they also need to have their first dental screening. And I call out dental because dental is often forgotten, because a lot of parents think that, oh, okay, my child, just turned 1. Do they have to go to the dentist yet? But as you see listed here, we do have dental screening. They may not need a cleaning just yet, but just screening so the dentist can, advise the parents on what they need to do and how to keep the kids' mouths clean and prevent cavities and so forth. So this is one of our ways or our interventions that we send out to the parents. And then we have our next slide, please, Iris. Okay, so then we have this flyer here. This is a mailer that we send out to the parents of kids that are between 0 to 15 months. And this is a wellness and immunization mailer. Here we basically note to the parents, we document for each of the parents what is needed for for the kids, and how often the kids should be going in for well child visits. We have that listed here, the whole schedule. We also have with that QR code, if the members are able to, if they have a smartphone and they're able to use it, they can use this QR code that is actually going to redirect the parents to CDC, the CDC schedule, and it will actually provide the whole schedule for what vaccinations are needed for the kids. So we have that here, and then once again, like I mentioned, we educate the parents on all the different types of screening needed for their kids. Next slide. Okay, so then we also have our preventative care letter. This goes out every June. It goes out annually once a year. We update this information every year for our members as well to make sure it's accurate, and we're giving the most, accurate and new data that we have out here. So we send this out annually to our parents, and this preventative care letter is for kids that's between the age of 3 to 21. So as you can see, that's a wide range. I will answer this question in 1 second. So for this particular preventative care letter, we send this information out to kids between the ages of 3 to 21. And what we have here is just, a lot of verbiage on dental visits, making sure the kids go in for their checkups. So I want to focus a little bit here. So in the past, I know that one of the reasons why I love public health is for the education component, right? So growing up, when I was younger and, as a kid, back then we had the idea, or a lot of parents had the idea that, okay, if my child is healthy, they're not coughing, they don't have the flu, and, I'm giving them their vitamins, well, do they need to go to the doctor? And over the years with, data, research, we know that preventative care is very important, right? Which is where me and Iris comes in, right? So this is one of the reasons why it's important to get this information out there to the parents, because sometimes parents, it's not that they're not taking them in because they don't want to, but sometimes they just honestly, they may not know that, okay, it's important just for the developmental piece of your child that they go in at least once a year. So sometimes parents really just don't know. So that's the purpose of the reason why we send out this information, to let them know it's still good to take your child in once a year, even if they haven't been sick, just to make sure they're growing and developing as they should. So that's what this information is about. Once again, talking about their vision, their hearing, going to the dentist, and presenting any questions that they may have to their doctors, the child's PCP. Next slide. Okay, so along with the preventative care letter, we also have an HPV flyer insert that we use for age 9 to 13. So if your child or if the parents, kids, if our members fell within that age range of 9 to 13, and they had a care gap that for HPV, we would put this insert along with the preventative care letter that we send out every June. So as you guys may already be familiar, one of our measures is immunizations for adolescents. So between the ages of 9 to 13, I really want to say closer to 11 to 13, kids are supposed to be vaccinated with HPV, Tdap, and meningococcal, right? So those are the three that those kids are supposed to be vaccinated with between that age range. HPV starts a little earlier, between like the age of 9 to 13. So HPV is one of the vaccinations that you guys may be already familiar with, but we have been having a hard time with in general, I would say, in the population in general, across all managed care organizations, with having parents have their kids have HPV. There's a lot of reasons that parents are a little skeptical about having their kids have HPV vaccination. But honestly, I will tell you, it's really important for a lot of reasons. We're seeing an increase with oral cancers later on in years. And if kids can have it at a younger age, between 9 to 12, this will help prevent them, while it may not be as necessary now, but as kids get older, it will prevent them from various oral cancers, and just HPV for females and males as well as they get older. So a lot of parents wonder, okay, well, why do we have to give my child this at this age? Because they tie the HPV vaccination along with sexual activity, when that's not necessarily the case at this point. But it can help prevent a lot of HPV-related illnesses at a later age, right? So this is a vaccination that we continue to struggle with, and this is one of the reasons why we also created a whole informational flyer that we also accompany with the preventative care mailer that I just mentioned before. Next slide, please. Okay, this is just the back and the front of the insert. So at a later time, you could look at this. Next slide, please. Okay, and then we have lead screening. Lead screening is an area that, once again, all MCOs throughout our state are in need of help. So if there's any of you guys who work with organizations that promote lead screenings, I really would like to promote the fact that any help and education to parents is really necessary to get out there. So lead screening, for the purpose of HEDIS, we typically want a child to have 2 lead screenings by the age of 2. However, for the purpose of HEDIS, we look to make sure at the very least, that a child had 1 lead screening by the age of 2. And that's what we promote here in our flyer. We sent out this flyer to our members. And when I say we send these out, we send these out to members who are due. So we don't send these flyers to every member. We send this out to members who have a care gap and are due for these particular measures. So in the case of the lead screening, we would send this out in January and July to the guardians of our kids to educate them on the importance of lead screening, and not only that, but just educate them on lead poisoning and the hazards of lead poisoning, right? So this goes out to the guardians of our members, and we educate them on lead poisoning, and we give them some stats here as well that they can look for, and we also give them symptoms that they can look for kids as well, and we send these out. So I think that may be my last. Is there another slide?
Nope,
Iris?
it goes right back to me, Khadijah.
Okay, sure. Okay, so I was a little long-winded, and I will make sure I can answer your questions, because I did see a few answers come up in the chat as soon as we're done, but I'll let Iris continue with the presentation, and then we'll answer afterwards.
Sure, thank you, Khadijah. So as Khadijah was explaining, the specific Horizon Medicaid member support programs to address some of these specific HEDIS measures, we in the health education team create our health promotion initiatives and our outreach with a keen attention, right? So it's health education with intention is what I call it, right? So we measure everything, because from my clinical experience, if you don't document something, it never happened, right? So documentation and data really helps support the many initiatives that we and the outreach efforts that we have to implement, but they also tell a story, right? The population that we serve is nuanced, it's different, and the feedback that we get not only from the larger community, our members, but our community partners servicing our folks. This is how we develop outreach efforts that are relevant, right, and can create some type of impactful outcome, right? So in the slide that you see in front of you, as part of our health education presentations, so that this middle, do you see my cursor at all? Do you see my cursor? Okay, cool. I wasn't sure if you did. This middle section denotes like the health topics. Now this is year to date from January. We're only in March, so this number is quite low, but the main health education topic is listed. And these are the top like 25. We don't usually list them out too long, because as the year progresses, this chart gets a bit long, right? But just because we are speaking to, let's say, immunization, right? That doesn't mean that we're not going to talk about diabetes. These conversations are fluid, right? So we definitely try to support many